Hello, my name is Dr. Nicole Rochester. I am a board-certified physician, professional health advocate, and the CEO of Your GPS Doc. And I am thrilled that Capital Caring Health has asked me to share information with you about heart disease and its impact on patients and families, and how we're managing heart disease and other chronic conditions during the COVID-19 pandemic as part of the Stay Safely at Home program. So let's get started by talking about what is heart disease. When we talk about heart disease, what we're really talking about is heart and blood vessel disease, also known as cardiovascular disease. And at the crux of heart disease is something called atherosclerosis. What that means is a buildup in your blood vessels of fatty material called plaques. If you can imagine a pipe in your bathroom that's clogged with hair and other materials so that the water cannot flow freely, that is exactly what happens in cardiovascular disease. We have plaques or fatty material in our blood vessels that prevent the flow of blood and nutrients and oxygen to our organs. So let's start with the most obvious form of heart disease. When most of us think about heart disease, the first thing that comes to mind is a heart attack. And this is called a myocardial infarction in medical terms, but we're just going to call it a heart attack. What happens when you have a heart attack is that the blood vessels that supply the heart become blocked with those fatty plaques that we just talked about. And as a result, your heart muscle is no longer able to get the blood and the oxygen and the nutrients that it needs. Let's talk about the signs and the symptoms of a heart attack. The one that you probably think of most often is chest pain. So when you have a heart attack, you can have pain in the middle of your chest, you can have pain on the right side or the left side of your chest, and sometimes that pain will radiate up into your neck or into your jaw. Other signs and symptoms of a heart attack can include sweating, or you can have shortness of breath. You can also have dizziness or significant fatigue. It's important to know that women sometimes have different symptoms when they are having a heart attack. When women have a heart attack, they may have nausea or an upset stomach. They can also have significant fatigue or shortness of breath. And sometimes these symptoms go missed or they are misdiagnosed with other conditions. So it's really important to highlight those differences. Another type of heart disease is what we call an arrhythmia. That's just a fancy word for an abnormal heart rhythm. Now we know that our heart has a normal rhythm, right? Your heart goes boom, 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 boom. When we have an arrhythmia, your heart can beat either abnormally fast or it can beat abnormally slowly. When your heart is beating abnormally fast, you may experience symptoms that we call palpitations, which will feel like a fluttering. You can literally feel your heart jumping around inside of your chest. Other signs and symptoms of an abnormally fast heart rate may be things like feeling short of breath or feeling like you may faint or pass out. You can also have an abnormally slow rhythm. And when that happens, you may feel like you need to faint or pass out. You may feel very tired, or you may experience dizziness. So those are the signs of a heart arrhythmia. Another type of heart disease is heart failure, sometimes referred to as congestive heart failure. Congestive heart failure is what happens when your heart is no longer able to pump and squeeze that blood out to the organs in your body effectively. So if the heart doesn't function properly, you can imagine that not only will your heart suffer, but all of the other organs that depend on blood will suffer as well. The signs of congestive heart failure can be very similar to what I just described for arrhythmia. Some of the signs include feeling very tired. You can develop shortness of breath. It may be difficult for you to lie down flat. In fact, some people find that they have to sleep on multiple pillows or maybe even sit upright in a chair to sleep. Other signs and symptoms of congestive heart failure can be swelling in your feet or in your ankles. Or if it gets worse, that swelling may also go to your arms or even to your face. Another type of cardiovascular disease is stroke. Now, when we think of stroke, we may not think about cardiovascular disease because it happens in your brain and not in your heart. But a stroke is caused by a blockage in the blood vessels that supply your brain. A stroke can also be caused by bleeding in those same blood vessels. The most common signs and symptoms of a stroke include sudden paralysis on one half of your body, a severe headache, confusion, or weakness. So those are the signs of cardiovascular disease. Let's talk about who is at risk for heart disease. If you have underlying conditions such as diabetes, high blood pressure, or high cholesterol, those things put you at risk for developing cardiovascular disease. Other risk factors include a family history of cardiovascular disease, especially in your parents or in your siblings. Age is also a risk factor. So if you are over the age of 50, you are at increased risk for cardiovascular disease. Another risk factor is actually being a man, although of course we see heart disease in both men and women. Based on what I've described, I'm sure you can appreciate that heart disease or cardiovascular disease has a significant impact on patients. It interferes with your ability to lead a normal and vibrant life. It also has an impact on family members. If you have someone helping to care for you, whether that is a spouse or maybe your adult children or even a neighbor or a friend, then heart disease has an impact on them as well. They have to be familiar with the signs and symptoms of heart disease. They have to be aware of the medications that you take. They have to keep up with your medical appointments. So this can take a toll on family caregivers as well. Not to mention the fact that family members worry and care about their loved ones. They worry about the complications that you may suffer as a result of cardiovascular disease. I want to talk a little bit about COVID-19 and the impact that it has had on heart disease and other chronic conditions. There have been studies that have shown that during the COVID-19 pandemic, many of us have delayed care for our chronic diseases. In one study, 41% of people reported that they delayed care, meaning that they didn't go to their doctor's appointments. They didn't get blood work or other recommended tests. They didn't make that follow-up appointment with their cardiologist or other specialists. Now, we understand and appreciate that COVID-19 has taken its toll on all of us. And there are many reasons for skipping preventive care and follow-up care during the pandemic. For some of you, maybe you've been worried that you would be exposed to COVID-19 if you sought medical care. I need you to know that your doctor and the hospitals and the other healthcare facilities have gone to great lengths to keep you safe during the COVID-19 pandemic. For some of you, maybe you utilize transportation services that have not been readily available during the pandemic, or maybe even your friends and family members have not been as available to help you get to those medical appointments. Regardless of the reason that you may have delayed care or avoided care during the pandemic, I want to encourage you to now reach out to your doctor. Go ahead and schedule that appointment that you may have missed last year. What we know is that delaying or avoiding care puts your health in jeopardy. We want you to be safe. We want you to be the healthiest you. And now that there's a light at the end of the tunnel, hopefully you have already received your COVID-19 vaccine, or if not, hopefully you will get one soon. This is a perfect time to follow up with your primary care provider and with your other specialists that help you manage your chronic diseases. I hope that this information has been helpful. Be sure to visit the Capital Caring Health website for more information about their Stay Safely at Home program. And I'll be back to share more information with you about living well with a chronic illness. Have a wonderful day.